Hi everybody, I haven't done a live for ages, but we're back in lockdown, so how else are we going to stay sane? Apart from by me inviting all of my amazing contacts and friends within the industry. Hi everybody. Live on here to answer all of your questions. I've got so many questions. Can I just say, I'm just keeping an eye on when Dr. Mahto joins us. Look at them, I've printed them all out and I've sent them to her. And we're going to basically go through and answer all of the questions that came through. There she is. And they're going to be questions that you want answering anyway, even if they're not your specific questions, I promise. And she's brilliant. One of my all-time favourite clinical dermatologists.
Hello.
Happy New Year.
Happy New Year. How are you?
It's not too late to wish Happy New Year, is it?
I don't think so. It's been such a weird year already, hasn't it? Just starting. So, yeah, it's all good.
We've had a whole year of nightmares in what, about 2 weeks?
It feels like it, doesn't it? I'm not sure 2020 is off to any better a start than most of last year, but it's okay. It can only get better from here.
Are you still doing all of your clinical appointments online?
I am actually. I just feel at the moment, well, certainly when we got back, the rates in London were so high that I just felt that it was just safer to do what I could at home. So for the time being, everything is remote. I'm going to reassess that though in maybe the next month or so.
Okay, so one of the questions that actually, and you've obviously seen all these questions and more came in afterwards, but I just couldn't inundate you with any more. You're too popular with my followers. One of the questions was actually about how easy it is to get hold of a dermatologist and how do you decide when you should see a GP and when you should see a dermatologist, and is it different now in the pandemic?
That's a really difficult question to answer. I mean, generally speaking, if you, putting private medicine aside, if you are purely looking at NHS appointments and you have an issue with your skin, your first port of call should still be your GP. Your GP will either look at your condition, feel confident that they can assess and manage it. They may give you some prescription treatments and hopefully things will improve. But there are situations where you may have a little bit of back and forth with your GP and either the treatments aren't working, you need something a bit stronger or a bit more specialized, or there's a question mark around what the diagnosis is, in which case at that point your NHS GP would refer you to an NHS dermatologist. So that's the route I would say probably for most people that they would follow. But there is a separate route in the UK, which is obviously the private medical route as well. So if you've got private medical insurance, you're insured with one of the big insurance companies, you can probably, depending on your policy, call them, say, I need to see a dermatologist, and they will authorize that. So that's the second route. The third route is if you are just desperate to see a derm, you haven't got insurance, but you do have excess cash to be able to pay for it, you can do what's called self-fund an appointment. And you can pick a derm that you want to go and see and you can book an appointment. So there are a couple of ways to be able to see a dermatologist, but you know, sadly, some of it does come with privilege and how much money or private insurance they may be, particularly if you want things to happen quickly.
One question about that process, and then we'll go on to one of the questions that you and I discussed on DM earlier on.
Yes.
Are all clinical skin conditions funded by the Bupas and the AXAs and the Vitality Healths?
Oh, it's a really tricky one. So Bupa, AXA are probably the biggest ones, and certainly in London, they probably have the majority of people that have private medical insurance will be covered by them. They are also some of the trickier insurance companies to deal with, mainly because they will see a lot of skin issues as cosmetic rather than medical, or they will see something as chronic, in which case they won't fund it. So I'm aware, for example, that Bupa have recently said that they will not fund acne at all anymore because they're seeing it as a chronic condition. Now, you know, acne is probably one of the most common reasons why people present to a dermatologist, particularly in the private sector. So it is becoming increasingly difficult as well with the insurance companies to make sure that you will necessarily be covered for every single skin issue that exists out there.
It's very interesting because I only asked that because I had a conversation with a friend today and she's thinking of getting HRT and she has private healthcare and she went, I'm set. And I went, oh no, you're not.
Yeah.
So I'm very lucky to have good skin. But when I went through the menopause, my private healthcare did not see it as being essential to my health at all.
It's a really bizarre thing, isn't it? And I think you can get caught out because you can end up spending lots and lots of money every month paying your insurance, paying your premiums. And then when you actually need to use it, a lot of stuff isn't covered. So I know that there are a lot of people at the moment, and what they're doing is rather than put the money into medical insurance, they're almost creating a separate savings account, putting money into it and going, okay, so that's for the rainy day, for when I need to see a doctor for whatever reason that might be privately. And that's the way that I'm going to do it, rather than go via an insurance company. And I know that's becoming a lot more popular because of this issue where a lot of things aren't covered and you can be caught out.
And also, I think, with all the best respect to the NHS in the world,
Yeah,
it's finite resources, isn't it? And we have to accept that. And I think now more than ever we realise it's finite resources.
yeah.
That to them maybe your psoriasis or your eczema or my hot flushes just are pretty low on the priority list, and I get that.
Yeah, it's strange, isn't it? Because I would say skin was already pretty low on priority list because of the NHS and limited resources. But I think what we're seeing now is it's like low priority on a completely different level. And it's understandable because obviously, yes, we need to be treating COVID and COVID is the priority right now. But I you know, from a practical point of view, I do fear, how are we ever going to catch up from all these delayed appointments and all of these issues that we also know it's not just the skin condition getting worse, but it's the impact it has on your psychological health that's going to get worse as well. I think we're in for some really difficult times ahead, to be honest.
I agree. I think if you're a realist, you don't have to be a skeptic or a cynic.
Yeah.
You just have to be a realist to realise that. Which brings me to a common question that we talked about.
We did.
Which explains to a degree the growth in online private dermatology clinics. Things like Skin and Me, I know the guys behind it, they are all clinical dermatologists, most of whom are still working with the NHS. And then originally Dermatica.
Yeah.
Thoughts? Good, bad, indifferent? What are your thoughts?
Do you know, so I also know the people behind both of them. And I know the Dermatica guys particularly because they were the first people that came along to do this. So I know Dwayne D'Souza, who set up Dermatica, and he comes from a pharmacy background. I think there are pros and cons, and I think it depends on what you need. I don't think it's as simple as it's good or it's bad. I mean, the plus side, it's convenient. It allows access from the comfort of your home if you're not able to see a dermatologist. So there are definitely big ticks that work with that. The downsides are, you know, partly, and I think we may have touched on this in your last live, but in the UK, people's attitude to dermatology is very different to if you were in the US or in certain parts of like Europe, where everyone has a derm and everybody has a long-term relationship with their derm, and their derm does their anti-aging and they do their mole checks and they do their injectables, and you know, they cover everything, and it's almost like a long-term relationship one has with that doctor. You cannot get that with an online service. So I think that's one thing, you know, all of the nuances involved with knowing the individual. I think one of the second things that I would say is a lot of those skin conditions that the companies look after, they focus on the face. Now, a lot of issues aren't localized to the face. So for example, you know, if one of these online services is offering acne treatment, for example, well, acne does affect the back and the chest as well. How easily can you see that? How quickly can you make a judgment whether skincare is the right thing that somebody needs, or whether actually their skin problem is beyond just needing a little bit of skincare, even if it's prescription, and needing something else? So the worry then becomes, are you still slightly delaying what it is fundamentally somebody needs, and they're still paying for treatments that weren't going to help to begin with? Now, the counter argument is, yes, that they're dermatologists, they're doing assessments. That is true, but the question then becomes, are those photos being sent in just of the face, or are they of other parts of the body as well? So I think for the current situation that we're in, and because we've ended up in this unforeseen pandemic, they're doing incredibly well. And it's easy to see why they're doing so incredibly well. But I do question, had this pandemic not happened and we were still working in that traditional model where you want to see the skin, you want to touch the skin, you want to be sure it is acne and it's not rosacea, and that there's not another couple of things that are going on, you wouldn't have been able to do that. But I think the way things have worked out, they're here to stay. And I think we will see more of them as time goes on. And I think we'll see multiple iterations of how they work as well.
The interesting thing is, I think of them like the Peloton of skincare. Good in a pandemic, but are they ever as good as a personal trainer? And also, can I just say, yes, I totally understand that sun damage and acne are two major issues, but they don't treat eczema, psoriasis, they don't treat dermatitis. Perioral dermatitis is going through the roof amongst my followers, mainly because I think they're overusing active ingredients and they're stripping their barrier function. But they don't have a metronidazole that they can prescribe, and they don't prescribe oral medications. So there is a limit to what they can prescribe.
And there's also a limit also to, because a lot of it is also around hyperpigmentation and sun damage, which you mentioned. And again, the thing is, it's not just skincare. It could be peels, it could be laser. So I think there's a huge section of treatment that one is missing out on, because, you know, ultimately, if you have got a number of tools at your disposal, you're only going to use those tools that you have at your disposal through a platform. So, you know, certainly like that. So I think it's easy, it's accessible, it's here to stay. But I agree with you that, you know, fundamentally, it can't replace that longer term relationship, plus also the sheer menu of treatments that one could be given depending on their individual skin problem.
And I don't think that there would be a founder, certainly not the Skin and Me founders, that wouldn't be sitting there watching us nodding, saying, we realised, but we had to do something. And I think absolutely, we're all on the same side in the end, but I agree. It's absolutely not the same as having, I mean, somebody could sign up for Skin and Me and get a treatment for acne that is an underlying polycystic ovary issue, but the polycystic ovaries aren't being treated, and neither would the excess body hair, and you can't have blood tests
that might go with it, which might work to, you know, might respond to Spiro. Absolutely. So I think that's where I think there will be multiple iterations of what we see of how online skin services will work over the years.
And I do think online medical services, full stop, have come a long way in the pandemic.
For sure.
So, you know, for me, I remember when I had a shoulder surgery privately, I remember logging on and meeting my shoulder surgeon before I even went in and saw him, and he did my assessment, because he was too busy and he just needed 10 minutes online rather than an hour. And that was the beginning. That was just that was about 1.5 years ago. And I thought, actually, this is the future for the initial consultation. It makes complete sense to me.
It does. Comfort of your own home, not trekking on the tube for an hour to get to the clinic for a short appointment. I mean, there are so many benefits to having medical appointments at home.
Yeah, absolutely. Right, okay, let's go straight in.
Okay.
Shall we start with pigmentation? Because I think it's a really interesting one.
Sure.
And somebody asked the difference between melasma and sun damage, and the best way, in your opinion, to treat it.
Okay, so melasma and sun damage are definitely the two most common issues that we see under the blanket of hyperpigmentation or increased pigmentation. The difference is, essentially, with sun damage, it tends to be something that will creep up on you as you tend to get older. You know, with each year of life, we get a bit more sun, a bit more sun, a bit more sun, and suddenly your skin has enough and you start getting freckles or slightly larger sunspots, usually on the face, the back of the hands, and the forearms are the common sites to see it. It tends to be much more common in people that have got fair skin, that have had lots of sun exposure. But equally, people that have got Asian skin can also suffer with not sunspots, but pigmentation where they notice just chunks of their skin look darker in color. So that's one thing. The separate issue is melasma, and melasma is what I would call a medical skin condition. Melasma occurs due to hormonal influences, due to genetic influences, can be worsened by sun exposure. But what you normally get is increased pigmentation, normally on the face, which is symmetrical, so it often affects both cheeks, so it will affect across the forehead or the upper lip. Can become worse during pregnancy. That's a common time where people may develop it for the first time. So as a general rule, what I would say is one is a medical skin condition. The other, I would say, is just the natural aging process of the skin. So that's the first differentiation. But in terms of actually treating them, the treatments aren't that dissimilar, because essentially what you're trying to do is you're trying to get rid of the melanin or the pigment that has deposited in the upper and the lower layers of the skin, your epidermis and your dermis. So simple treatment options. I mean, I know people will go to over-the-counter skincare first. And the first thing that I will say is over-the-counter skincare can only do so much, because by definition, over-the-counter skincare can't really penetrate much beyond the skin barrier. It can't go beyond the stratum corneum, which is the top layer of the top layer. But if you've got pigmentation deeper than that,
it needs to be in the dermis, doesn't it? Yeah.
Exactly. You know, over the counter won't cover it, but good over the counter ingredients that are generally recommended for pigmentation do include things like vitamin A, so your retinoids, things like niacinamide, things like vitamin C to some degree. I don't think vitamin C is fantastic, but you know, it can be a skin brightening agent. Kojic acid, products containing mandelic acid, tranexamic acid. They're usually kind of the go-to things that we think about. If you've tried that and it doesn't work, the next step really is looking for medical treatments. So if you came to a clinic and you saw a dermatologist, probably the first thing that they would recommend is using something that does contain a degree of hydroquinone. And hydroquinone remains one of the gold standard treatments for treating hyperpigmentation. Hydroquinone tends to get a really bad rap because it's used in illegal skin lightening products. But when it's used in short, sharp bursts with the correct instructions for the right duration of time, it's actually really effective and really safe to use. So that's option one, using creams that contain things like hydroquinone. If that doesn't work and you try prescription creams for 3 months, you see no benefit at all, I normally say the next step is consider a course of chemical peels. Chemical peels,
which is exactly what somebody has just said. Carol is listening to this and has just exactly said what you...
Oh, right, okay. Yeah, next step would be chemical peels. So you would look at the depth of the chemical peels. So chemical peels come in very superficial, medium, and deep. And the very superficial and superficial target the epidermis, the top layer. And then the medium depth peels tend to target the epidermis, but the slightly deeper layers of the dermis as well. And then the deep peels, we tend not to do quite so often anymore, mainly because they tend to come with a few other complications. They require a lot of monitoring if you do them in clinic. But a medium depth peel can be very effective at shifting things like pigment.
I remember you doing one.
I
was so jealous that you could prescribe your own peel in the first lockdown.
That's absolutely right. I think we went into lockdown in March and I did a medium depth peel in April.
I remember.
And to be fair, I was terrible in the summer and I didn't, you know, I probably should have protected more than I did. So a lot of it has come back. But actually, if you then look after your skin properly and you're really effective with your sunscreen, actually you can get a good run of that pigmentation shifting. The only problem with most sort of conditions of pigmentation is that it does return. So anything that you do, it's gonna come back at some point in time. Some of that partly depends on like the original drive of that process in the first place. And some of it depends on how good you are looking after your skin. You know, if you're gonna go straight on a summer holiday, it's gonna come back. But, you know, medium depth peels, super effective, but, you know, not permanent. And then there are also lasers that can also help with pigmentation, with melasma, by targeting the melanin in the skin. The thing with laser is, I would say it's much safer for those that have got fair or light skin types to target sun damage than it is for darker skin types, because it can be a little bit unreliable. So from a practical point of view, if you've got skin of color and you're going for laser for pigmentation, you probably need a lot of pre-treatment with hydroquinone and peels first anyway, before somebody would laser you, and then afterwards as well. Whereas if you're somebody of your coloring, for example, you could have laser treatments, you know, that would actually shift freckling, pigmentation quite easily. So it does involve your skin type, the expertise of the laser practitioner, the type of laser that's being used.
Yeah. Ask the experts. Let's talk about blackheads. So many people asked about blackheads, much more than normal, and I'm convinced it's masks.
Yeah. I think masks are really creating absolute havoc with our skin, not just with blackheads, but with perioral dermatitis, with worsening of eczema, with worsening of psoriasis. I think there are lots of issues. Also, the weather has become quite cold as well. And all of those things can also aggravate chronic inflammatory skin conditions like that. The central heating doesn't help. The cold weather drying out our skin doesn't help either. But from a practical point of view, the first thing with blackheads in terms of kind of home treatments is you've got to be super patient. The life cycle of a blackhead is about 25 to 40 days. So the blackhead that you're seeing...
You've just blown my mind.
Yeah, no, so that's the thing. Blackheads actually, they do actually develop quite slowly. They don't develop immediately. So that's the other reason that when you have blackhead treatments, you do have to repeat them roughly monthly when you go for things like extractions or peels, because that's how quickly everything is reblocking, reforming, and replugging up again, if that makes sense. So in terms of over-the-counter stuff that you can do, using products that contain vitamin A, ideally go for something that's going to be strong enough. So either use something like retinaldehyde or a minimum of a 0.3% retinol. Even better, get yourself a prescription retinoid, so something like tretinoin or adapalene. They can both be pretty useful, but they are prescription. So that's one thing. The second thing is also making sure that you're appropriately chemically exfoliating your skin. So using glycolic acid or lactic acid, be that in the form of a toner or a cleanser, whatever your preference is to do so. And they are excellent starting points, but you have to be patient. It takes 12 weeks to see benefit from clearing those blackheads and improving skin cell turnover. So that's one thing in terms of ingredients. Had we not been in COVID and, you know, one could see a good facialist or a good esthetician, the next thing I would say is going for regular extractions can really help as well. You know, somebody that is properly trained to squeeze those blackheads out for you, not only does it give you an immediate sense of relief that that blackhead has gone, but it also prevents that blackhead from turning into acne, like a proper acne lesion further down the line that is red and bumpy. But we can't do that right now. But, you know, extractions, I think that I massively rate them if they're done by the right person. Do not go to YouTube, buy a comedone extractor and try and do it yourself. Been there, done that. You do actually damage your own skin. Like I would go to somebody to have this done, is what I would say.
And can I say, if anybody's listening to this right now, you need to go and follow Dr. Mahto, because Dr. Mahto has had her whole journey with acne and breakouts. This woman is speaking not only as a medical expert, but firsthand, right?
Yeah.
Been there,
I've
seen it, done
it,
got the t-shirt.
Yeah. And know what works and what doesn't work. And when you really do need to kind of outsource to somebody else squeezing your blackheads out for you, you know,
I
am not the person you see for that.
With an I get a tiny few on my nose, but with an esthetician, they know when to stop. And we don't know when to stop with our skin. We just keep digging and digging and digging. And that's when you damage your skin so badly, don't you? Yeah.
Absolutely. And I think the other benefit they've got is they're working over you, so they can actually see properly, whereas you're looking at a 2D image or reflection of yourself in the mirror as you're trying to do it. You're never going to get the same angle, the same depth, and all of those other kind of nuances of how it's done appropriately without you just sticking your nails into it and hoping for the best. So
is your advice the same for maskne generally?
In terms of maskne, I think that the additional ingredients that you can benefit from actually are using things like targeted salicylic acid on the spots themselves. If you're wearing a mask and you're going to the shop, no one knows what's going on underneath that mask. So I almost recommend, you know, after you've cleansed in the morning, stick on a salicylic, like, you know, targeted spot treatment directly onto the area, let it dry, put your mask on, go about your business. And it's working during the day as well, because obviously the longer these products are left on the skin, the more benefit you're going to see from them. So, you know, they can help. Outside of COVID, chemical peels would have been great for blackheads. Doing chemical peels regularly are really helpful. But, you know, I think ultimately we're in a situation now where we're just going to have to make do
DIY.
With things that we have at home. So either it's like retinols or prescription retinoids. I think they are the simplest way.
You mentioned non-prescription retinols there, and you mentioned 0.3%. Are you a fan of 1% retinols? Because that's what I use. I mean, I'm a tough old bird. I've worked my way up, but
yeah.
What are your thoughts?
I have to be honest, I tend to just use the prescription strength stuff.
Do you?
Yeah, I do. But it's because I'm using it for a dual purpose. I'm using it not just for the anti-aging, but for the acne benefits as well. But if you're not looking for those necessarily acne benefits as well, your skin is slightly sensitive, or you may have an underlying condition like perioral dermatitis, eczema, or psoriasis, you probably do want to go explore something like a retinol 0.321% rather than jumping straight in at the deep end with a prescription product. And again, that assessment is important.
And I think the thing for me is as well is I make my living on camera. I just don't want the peel.
Yeah.
The peel drives me mad.
Yeah, no, that's so true. That's so,
And I've
so
never
true.
managed to get over that hump as well. Is there anything you can do for dark circles?
So with dark circles, do you know what I'm going to start off saying? And I'm going to start off saying this because I think that I've seen a lot of stuff. I mean, over the summer and with lots of political movements that were really important, like Black Lives Matter, I'm glad that we are talking about skin of color in general, particularly things that affect skin of color. One thing I am just generally noticing, though, is my concern is that it's becoming a little bit faddy and people are preying on insecurities that people have when they have skin of color, like dark circles, and flogging treatments that don't work. And I'm going to start off by saying that because I think it's genuinely a problem. Now, that's not to say that if you have dark circles and you feel that it makes you look tired or it makes you feel like you've not had a good night's sleep and you want to get that treated, that's totally fine. But don't fall into this trap of thinking that just because you have dark circles and you have skin of color, you need to buy X product that's going to fix the problem, and it must come from a person of color that's telling you this is what they need to do. I just want to put that out there first. But in terms of dark circles in general, it does depend on what the underlying cause of that dark
You and I have
circle
talked about our dark circles before because we have different causes.
We absolutely do. So the question is, you have to look, I mean, firstly, at the anatomy and the physiology of what's going on around that eye area, that orbital area. But is that dark circle there because there is increased melanin or pigmentation in that skin? Is that dark circle there because of the natural aging process of the skin? So what's happened is you have lost fat underneath the eye. Now, the layers of the skin, well, the layers actually underneath your eye area are you've got skin, then you've got fat, then you've got muscle, then you've got bone. If your fat layer thins out, what happens is what your eye will catch is the light reflecting directly through the skin onto the muscle. The muscle is dark because the muscle has got a rich blood supply. And it's that darkness of the muscle, because there's less fat hiding it, that's making that circle look dark. So I think you have to look and see what the issue is. Sometimes there's a combination of both, in which case you have to treat both. Otherwise, you're not going to see an improvement in that dark circle. So if the issue is due to excess melanin or pigmentation, then using products that can potentially lighten that skin area. Now, I would not recommend that you do this with over-the-counter products because a lot of these can irritate the eye area because the eye area is thin, there is increased absorption at that site. You're more likely to give yourself eczema if you start doing really strong actives around that area. But if someone sees you, they assess you, you can use things like azelaic acid. You can use things like retinoids around the eye safely. You just need to be guided how to do so. And it's impossible to do, like tell an individual how to do that without seeing them and without assessing them. You can also do chemical peels around the eye area. You can also do laser treatments around the eye area. So those are options for pigmentation. Now, if the issue is a loss of fat underneath the eye area, the solution there actually is a tiny little bit of filler, usually hyaluronic acid, which can be injected in a few areas or put through with a cannula. So it's essentially like a plastic tube and it helps deposit a little bit of filler underneath the eye and it will recreate that volume that has been lost. So answer, I guess, is it depends on what the cause of the dark circle is.
Yeah.
Yeah.
100%. I agree with you. Although
yeah.
I actually can't, we won't go into this, but I actually can't even have filler around my eyes because they, what's it called when you get really puffy eyes because your lymphatic doesn't work around your eyes?
So periorbital edema is something that can get
I'll own that one as well.
Yeah, that one. So periorbital around the eyes, edema, swelling, but all it basically means is swelling around the eyes. And if somebody is prone to slight, if the skin is very thin, but you're prone to slight bags around the eyes, and what I mean by that is you're right about like sort of drainage issues. If you inject those areas, you actually do make the dark circles worse rather than better.
They swell. They swell.
Yeah. And hyaluronic acid, it's a humectant. It grabs water, so it's going to create swelling.
Yeah. I've learnt that over the years. That's been a hard lesson to learn.
Yeah.
Is there a right age to start using retinols? And do you think retinols are targeted at women and men that are too young?
So, I mean, you know, we know that the usual standard that's quoted is after the age of about 25, you start to lose about 1% per year of your skin's collagen. I mean, the aging process starts as soon as we're born, right? So, I mean, what I would ultimately say is the right time to start using a retinoid comes down to so many factors. I do think that there is a real issue where people are becoming very worried about skin aging at a much younger age than I have ever seen before. Like, this
bloody
is
Instagram.
I mean, I think it
is.
Airbrushing. Honestly, I think it is. Because I think that airbrushing, or that subtle filter that people use, it gets rid of any lines. And actually, it is normal to have some lines around your eyes. And
I love it when you post your real skin on Instagram.
Oh, thank you.
Yeah.
Do you know, I would rather people see that, like, I don't look good all the time and think that's what normal skin is supposed to look like, than have to do the damage that I honestly think that just using filters all the time causes. It resets people's idea of what skin should look like. And most people, their skin just doesn't look like that. Not in real life. Not when you meet them in real life.
Yeah, I completely agree. Skincare, or would you recommend any treatment specifically for post-acne scarring and hyperpigmentation? And is it always a derm route? Is over-the-counter going to do anything?
Look, I think if you can't see a derm, or if you've seen a derm, you've gone through a course of treatment for your acne, but you know, that's it, your appointments are over and you can't go back, what I would suggest is that you should go onto an over-the-counter retinol or retinoid. That's the correct thing to do. I mean, as a general rule, in my clinic, what I do is I treat the acne, then everybody goes on a maintenance prescription retinoid at night. And then once they do that, they all go on a prescription azelaic acid in the morning. And I like the combination of prescription azelaic in the morning to help shift pigmentation, the retinoid at night to essentially reduce any new blackhead or congestion.
You're going to love this one, right? Home LED lights.
Yes. I mean, I've got one, but
But that's what I love about you.
Yeah. No, I mean, look, you know what? Years ago, I was like, when my acne played up again, and I was like, I cannot do Roaccutane again. I'm going to try everything before I go down that. So I ended up buying a home LED light. I mean, look, anecdotally, it didn't work for me. But if we're going to talk purely, not me as a patient, me as a doctor, what I would say is one of the issues with a lot of home devices is that the energy or the fluence that they use is a lot lower than what you would get in a clinic. It has to be for safety reasons. So, I mean, look, if you've got money to spend and you fancy a new device, by all means, go out and buy one. I don't think that the evidence suggests that they're that effective.
My argument with home LED is, and I have to say, number 7 have got one that is half the price of anything else on the market, and I think that can only be a good thing. It's the same argument with home IPL.
Yeah.
Don't buy it and don't use it, or use it once and think it hasn't worked. Slow and steady wins the race. You're going to, because they work at a much lower, safer energy, and that is for the safety of people like me who just put it in and crank it up. Yeah. You're going to have to use them so many more times to get the equivalent of one clinical hit.
Yeah.
But if you're prepared to stick with it, I think from my personal experience, they give a glow.
Yeah.
Like the equivalent of going for a workout class.
Yeah. I mean, I think that's what I would say. If you've got the money to spend on it and you're not looking for anything immediately, I think home devices, again, you know, because of pandemic, that they've become super popular. It's interesting though, I remember, because it got cancelled this year, but IMCAS last year, which is the big dermatology, aesthetics, plastic surgery conference, which is always in Paris in January, they had a huge section on home devices last year. And I remember going to the session, and there was a lot of chat about the home device market and how it's going to grow over the next few years, and how a lot of that drive is coming from a lot of the sort of Chinese, Southeast Asian market, where there is that demand to be able to want to get clinical results at home, but that whole counter argument of like, we can't give clinical devices at home, it's not safe to do so. But it's an interesting space to watch. And
somebody just mentioned the Desi light there. That's the one that's about £7,000 or £8,000. And it's the one, you know, the one that's a full solid like body armor. And I think Desi do make in clinic ones, so, but that's so much money.
I know, because I was going to say, because if you think of something like a Dermalux, which is, you know, one of the standard clinic devices that a lot of clinics do use, a Dermalux doesn't cost that much.
I know.
And that's a clinical device.
I know. I'm of the opinion that I personally I'm not good with compliance.
Yeah.
And so I always describe them as being slightly like the modern equivalent of a foot spa in the 70s, gathering dust at the back of a cupboard. But
yeah,
that's me.
Nice to have, but
yeah. Yeah. But I say, like I say, if you don't use it, if you use it once or twice and you're expecting miracle results, please save your money. There are better things you can spend your money on. Is mineral makeup better for acne prone skin, and does wearing makeup under a mask make maskne worse?
So the first bit of that question, one thing I would say about sort of mineral makeup in general, I think makeup generally gets like a really raw deal. Like, we don't wear 1950s stage makeup that is really heavily oil based anymore. Like, makeup technology has moved on so much since those original kind of studies that were done on acne and makeup, and acne cosmetica is what it was called. So as a general rule, I don't tell all of my acne prone patients to switch to mineral makeup. I don't think it is necessary to do that. The people that I think benefit from mineral makeup are people that have got very sensitive skin. So if you've got rosacea prone skin, that's the time where I would say, well, actually, if your rosacea is very active, if your eczema is very active and you want to wear makeup, if your perioral dermatitis is very active, you may benefit from switching to mineral based makeup because it's more inert and it may cause less reaction. But as a general rule, I think if you're acne prone, what you want to do is you want to just kind of feel the textures. If you don't want to go through a massive long, the ingredients list can only tell you so much. And I think there's lots of ingredients that have been utterly demonized, like dimethicone and silicons in general, for acne prone skin. They're totally fine on acne prone skin. You don't need to worry about using them. But I would just say, go for something that is mattifying, go for something that is light and gel textured, rather than something which feels heavy and which feels creamy, and you probably can't go wrong with that. So I guess, no, I don't think everybody that is acne prone needs mineral makeup. I certainly don't wear mineral makeup, and I'm definitely acne prone. Would you agree with that? Because I mean,
I would, and I'd also do the proviso that, you know, for a lot of women with bad skin, makeup is their safety blanket.
100%.
Don't deprive them of that. And men, the important thing is just cleanse your skin properly at the end of the day. Don't sleep in it. Don't keep layering it on.
Absolutely.
That's all it is. The reason I ask about the mask and acne is I never get spots, and I've got a very painful lump here. Do you know what I've worked out it's from? It's from wearing a hat in the cold weather, and the inside of my hat is covered in old stale makeup. So I've given myself an acne cosmetica right there. It's totally my own fault.
Now, I do think actually from the mask point of view, if you are wearing masks for prolonged periods of time and you're wearing makeup underneath, I do think that the heat, the sweat, the occlusion underneath that mask, I think they can drive it. So it's interesting, like, you know, when I was going into clinic, I was like, miss wear foundation every single day. And actually all of last year, I've given up foundation because I was wearing masks for 8-10 hours a day. And quite frankly, it was giving me spots. So I think there is an issue where if you're wearing masks for prolonged periods of time, you do want to cut down on the makeup that you've got underneath.
What foundation, do you have a specific foundation range that you like for covering spots and pigmentation, and just from personal point of view?
Yeah, so it's funny actually, because I think my makeup needs have dropped drastically over the past year. But prior to COVID, I was always using pretty high coverage, and I would always do a 50-50 mixture blend of the Vichy Derma blend and the NARS tinted moisturizer. I found the Vichy by itself too heavy, but the coverage was good. And I found the NARS tinted moisturizer didn't give me the coverage that I wanted. But mixing the two together, I got exactly the right consistency to cover what I needed to cover. But recently, I've discovered the Trini De-Stress BFF.
Yes.
The kind of like
super lightweight though.
It's so good
and quite glowy.
It's quite glowy, but I find for me, the coverage, I've been with a bit of concealer, I'm really enjoying that as someone that has literally worn foundation every single day. So
as a sort of no makeup look.
Exactly. Or just even a good concealer by itself and just covering the areas that one needs.
Yeah. Thoughts on microneedling? Do you do it in clinic? Has it been sort of, I suppose, in a way, made redundant by lasers? And what about home microneedling?
Okay, so I think microneedling has got multiple benefits. It is good at kind of just boosting collagen in the skin. So it's a good anti-aging type treatment. It is also good for treating limited types of acne scars. And if the question is, well, which type of acne scars, it does depend on the site, it depends on the extent, it depends on the severity. So it's hard to say without assessing the individual, but it can be of benefit to that. I do think that clinic microneedling is more effective than home microneedling, simply because, again, for safety reasons, the devices that you get in clinic will penetrate the skin more deeply, which means they're much more likely to induce that kind of collagen response, that protein which gives our skin its support, its structure to plump the skin out, a much better chance of doing so. The home devices, I think, they're a bit of fun, but I don't think they're going to give you any kind of decent, good results with your skin. You know, your skin might look a little bit glowy afterwards because you've just increased the blood flow. But from a clinical point of view, I don't think you're going to see much benefit.
I interviewed Brad Pitt's cosmetic surgeon stroke dermatologist back in the day in LA, and he virtually completely erased Brad Pitt's pitted acne scars, and you can Google the pictures, but he did that under intravenous sedation and complete face numbing because the needle was so deep it had to get into the dermis and he was bleeding everywhere. But boy, it worked. It worked. It was amazing. And this was like, obviously, I mean, Brad Pitt's my age, so this was obviously 30 years ago before Fraxel laser was even around. So
yeah, well, it's interesting actually, because that whole really deep microneedling under sedation, it's not used that popularly in the UK. There are certain pockets in Europe, for example, where it can be offered as a standard treatment. But if you say to somebody you're going to be sedated for microneedling, generally the response of most people is like, actually, no thanks. I wanted something non-interventional.
But have you not noticed in America, they say sedate so much more quickly than we do? Their dentists sedate so much more quickly.
They do.
And they do high frequency ultrasound under sedation.
We just have it.
We don't. No, we're tough.
Yeah, exactly.
This is a really interesting one. Does the DHA, that's the sugar in self-tanners, and the erythrols in self-tanners, do you think they accelerate skin aging and dehydration?
I don't actually. I remember doing a piece on the dihydroxyacetone a while ago actually, and whether or not it was safe to use, are there any issues with it? And when I looked at the research at the time, and this was maybe about 3-4 years ago now, to be fair, I couldn't find anything convincing to suggest that it would accelerate skin aging. I think a lot of the issues though are, you know, if your skin is a little bit dry and you haven't prepped the skin properly to begin with, it is much more likely to look dehydrated as a result of that. So the prep before you use the tanner is really, really important.
I also think that using self-tan can make age spots and sun damage look worse.
Look darker. Yeah.
That's all I've noticed. I mean, and also I do think that modern formulations actually that are really rich in glycerin and hyaluronic acid are nicer than the old school ones, which used to be much more, I would almost say, like, not that I'm anti-alcohol in skincare, but they used to be quite alcohol based, so they would dehydrate the surface of the skin as well. Yeah. Perimenopausal, and if anybody thinks, why am I asking a dermatologist about hair? It falls under their remit as well. Can I just say this? They're not known for it, but it does. Your scalp is hair. They understand hair as well. Perimenopausal hair thinning.
Yes.
Should they try and get to a GP for a blood test before paying for a dermatologist? And are there new and interesting treatments out there moving forward? Not least of all for all hair thinning, not just for perimenopausal.
Yeah. So perimenopausal hair thinning usually falls into the category of what we would call female pattern hair loss. And it's to do with hormones known as androgens. And a relative increase in these androgen hormones can cause miniaturization or shrinking of the hairs, and the hair itself can become thinner. The classic places that you see it are the sides of the temples and then widening of the parting across the scalp, as well as generalized thinning. So that's one thing. But generally, hair loss itself often tends to be multifactorial. So it could also be due to potential dietary deficiencies. So the other thing that I'm seeing a lot of at the moment, and this month is a good example of it, but so many people are doing veganuary. So many people are switching to plant-based diets. Now, that's totally fine, but you often don't get enough iron if you switch to a plant-based diet. And I know that when I'm doing blood tests for other reasons on my patients, nearly everybody's iron is in their boots. And, you know, if your iron is low, it's going to make your hair fall out. So I think, you do need to look at the nutritional aspects. You do need to take into account any hormonal changes. But also there are other medical issues that become more common as one gets older. And thyroid problems and slowing down of the thyroid gland is another one of those. But underactive thyroid gland can contribute to hair loss. So I think your first port of call probably should be your GP if you're concerned. And it is important that a battery of blood tests are carried out. And they are carried out to check you're not anemic, to check nutrition, check all of those things. If a problem is found or flagged, obviously those things should be treated. The hair cycle is quite long compared to the skin cycle. So if you're iron deficient and you start taking iron supplements, you're not going to see any benefit within a week or 2 weeks or a month. You've got to be doing it consistently for at least 3 to 6 months before you're going to start noticing any improvements. The other things that you can do, if your GP is then satisfied that it is just female pattern hair loss and it's not anything else, is there are over-the-counter things that you can buy. So minoxidil or Regain. Now Regain comes in 2 strengths. It comes in the 5% and then the half strength. If you look at all of the clinical studies, in actual fact, it's the 5% in women that is useful. But when you go to a pharmacy, they will try and sell you the weaker strength as a female. So it's just something to be aware of.
Take a bald man shopping with you.
Yeah, and maybe just let your GP know or a health professional know that, you know, you have gone for the higher strength so they are aware, but you can use the higher strength.
You don't need a prescription. I know you can buy it over the counter, but can the GP write a prescription for you?
For the minoxidil, you shouldn't need it actually. Yes, they could, but you shouldn't need it. It's not a prescription-only medication, so you should be able to get hold of it.
And then if you follow any, and I'm sure you do, you follow any American dermatologists, is PRP as exciting as they're making it out on Instagram?
So there's a couple of things then. So yeah, so by the time you then get to the dermatology or well, dermatologist or plastic surgeon, it falls into either remit, the additional things that we can do. There are oral medications that can be given for hair loss. So drugs like spironolactone, finasteride, dutasteride, for example, you would need to be assessed to make sure that you're suitable for that. So that's one option. The other option, absolutely, is there are also some non-interventional treatments like PRP, platelet-rich plasma, which are gaining popularity. The difficulty that we've got with the current data on platelet-rich plasma is a lot of the devices that use PRP, they all produce different concentrations of platelets. People are also injecting the platelets at different intervals. So we still don't know what the right concentration of platelets is, how frequently you should be having those injections put into your scalp. But certainly the data looks very interesting and pretty exciting. And then there are also options of potentially even hair transplants. And there are some fantastic hair surgeons, plastic surgeons who specialize in hair that would also be able to do that. So there are actually a lot
I've
of
seen some
like
amazing results.
Yeah. Yeah, there are some good people doing hair transplant work at the moment out there, for sure.
The problem is it tends to all be on guys, because guys is so much more patchy. Rather than general thinning, they tend to lose it through here. So they harvest the hair here and patch it in here. Honestly, that technology has come so far. I've got friends who remain nameless, whose husbands have had it done. It's incredible. Unbelievably painful. Do you know that?
And also sometimes you do need to have 2 rounds of it as well, almost done at a certain period apart. It's an interesting one because often what will happen is plastics will send a dermatologist to review the patient first to make sure there's no underlying medical condition before they would do the transplant.
Yeah.
The reason also, I mean, I think men do have it more frequently than women, but I also think there's more stigma attached to a woman with hair loss than a man. Like with a man, as he gets older, it's almost expected, oh, well, you know, men lose their hair. But I think for women, you know, it's such a part of like beauty and femininity. There's a real like psychological stress that it creates, plus also I think women are less likely to be, oh, my hair was falling out, then I had a transplant, this is how my hair looks better. So I think also women don't come forward with their befores and afters in the same way as well from a psychological point of view.
That's really interesting. That's really interesting. I didn't know that. Biotin.
Oh God, I wrote a long post on biotin.
I know. Can I just say, if ever you've got any questions, seriously, I know I said this before, go and follow Anjali. She's amazing. and she does the most incredible deep dives, because I've spoken to a lot of experts about this. There's one small clinical trial on biotin that proved that it worked, and now manufacturers just add it in so they can make the claims, right?
That's absolutely right. I mean, essentially, if you're not deficient in something, taking more of it isn't going to help. And most of us are not naturally deficient in biotin because of the diet that we follow, that taking more isn't necessarily going to help our hair health. But I think that, you know, there's sometimes, you know, you've got a problem and you just want to feel like you're doing something.
Yeah.
And it becomes one of those things where you feel like this is something I can control. This is something I can do.
Yeah, I mean, from my experience, whenever I've spoken to people, I always think it's the get your thyroid checked, get your hormones checked, get your ferritin, your stored irons checked.
That's right.
And if you take those to an expert who can prescribe a load of stuff for you, but then I always like minoxidil, without a doubt. They're the basic things you do if you're in lockdown and you can't speak to an expert. Like, and also I think the interesting thing is, if you've noticed your hair started to thin, the research shows that you have to lose so much for you to actually notice it, that actually the problem's probably been going on for at least 6 months. Just as it takes a long time to get the hair back, it takes a long time to notice
to lose it as
well.
well. Yeah, it's completely normal to lose 100 to 150 hairs a day. That's actually quite a lot of hair.
It is, yeah. Can I use vitamin C on the back of my hands for age spots?
Yeah, I mean, there's no reason why you can't.
Wouldn't you just, I mean, I think this is such an interesting question to ask. I would personally
go for a prescription retinoid, but you could use vitamin C.
I always say to people, I'm sure the only reason I have remotely decent hands is because everything I take down here that's stuck on the end goes on here afterwards. But I do think with retinol, with vitamin C, I think it's one of those products that you don't get great overnight results. I think it's a little bit like having, I don't know, one of your fresh 5 a day. It's a long-term investment. You're not going to notice any things overnight.
There's no immediate benefit.
It's a preventative measure. Yeah,
I agree. To be honest, vitamin C is one of those, for me personally, it's take it or leave it. I don't love vitamin C. It's there, but there are other ingredients I think work better.
What
I mean, my phone's on 10%. Sorry. I'm just going to grab my phone charger because my phone's going to run out of battery.
No, I think mine's going to go as well. It's so funny you said that.
I'm going to have to plug in, and I'm just going to hold the phone. Hope that's okay. Right, there we go.
Okay, I'm going to go and get my charger because mine's trying to do the same. It's so interesting. Best moisturizer for an acne prone skin, and can acne be dry? I'm leaving the entire platform to you. I'll be back in a minute.
Okay, fine.
Professional of me.
No, we're all good. Okay, so best moisturizer for acne prone skin. You need something that's going to moisturize your skin, but at the same time, what you don't want is it's so greasy, it's counterproductive, and you're going to cause more occlusion. So don't work for any of the brands that I recommend, but I would recommend, I mean, the brand I'm going to recommend, I've never worked for, but I would say I like the La Roche-Effaclar H Moisturizer. And if you see me in clinic, that's normally the one that I say to use if you're using a lot of active acne ingredients and your skin is dry. In answer to the second question of can acne prone skin be dry? Yes, it can. It's unusual. Normally people that are acne prone do tend to be slightly more on the oily side. So the first question that would come to my mind is it definitely acne or could it be rosacea? So that's the first thing. But also if you're acne prone, you're using a whole load of active ingredients, it could be that's the reason your skin is dry. So it might not be the fact that your skin is naturally dry, it's the fact that you're trying to dry it out because of all the acne products you're using, and that's why you're noticing the dryness. So yes, they can coexist.
Can I just say, I love that I disappear for 2 minutes and you're coming back and saying exactly what I hoped you would say. For me, whenever people say that to me, I always say acne and dry skin doesn't make sense to me, but acne and dehydrated skin, probably from overstripping it with acids, does. Yep. What is your favourite sort of gel? I'm just about to plug mine in. What is your favourite sort of gel-like moisturiser for that sort of skin, and oils?
So actually, I mentioned I like the Effaclar H for that actually, because I find that it will give enough moisture without actually being counterproductive that you're putting so much extra grease onto the skin. So that's usually one that I would say. Yeah.
I'm going to go around the corner and finish this because I'm determined not to lose you. There you go. I'm plugged in. Right. There you go. Yes, I agree. For me, I think my argument would always be a gel moisturiser. Always a gel moisturiser. They're really nice. And the idea of a gel is it tends to be more water-based than oil-based and something like that. Yes. Right. Let me give you another question and then I'll plug this back in. This is so good. Best chemical exfoliators for oily skin we've already done. But what about dry skin? And why do dry skins require different chemical exfoliants, or do they not?
So I think if you've got very dry skin, but you still want to chemically exfoliate, I would go for something like lactic acid. Lactic acid is still an
My
alpha
favourite.
hydroxy acid. Yeah, so it's a good AHA, but at the same time, it's also good at binding water as well. So I think that could be a good option. Alternatively, using a low concentration glycolic and using it less frequently is probably also something you can get away with. Third option is going for a polyhydroxy acid, so something like gluconolactone or lactobionic acid. And both of those, again, they're new generation AHAs. So what they do is they also bind water and hydrate the skin as well. So I think there's a couple of options actually for people that want to chemically exfoliate.
I think it's really interesting. I find lactic much more hydrating on my increasingly drier skin as I get older.
Yeah.
And I don't mind glycolic, but it tends to dry out my skin. But polyhydroxy acids, and now they're available on the high street,
Yeah,
is amazing. So that technology I find much more gentle on my skin as it gets drier. Definitely.
for sure. I mean, I'm definitely using a PHA toner rather than my regular glycolic toner now. In the
Which one are you loving?
I'm really liking the Medicate one, actually. That's the one, like, it's so gentle, and I'm using it twice a day, and I'm still putting my spot treatment on top of that, and it's working quite nicely.
And this is the thing about PHA, and the Medicate one that Dr. Mahto just mentioned is called Press and Glow. You won't get that initial overnight tingle and hit that you get with glycolic, but for me, slow and steady wins the race. And I think PHA is one of the few ones that I found I can use with the retinol as well.
Yeah.
Because otherwise I get too sensitive. This is a really interesting one, and a lot of people have said this. Is it true that vitamin C can break me out and make blackheads worse? What's going on there with that process?
Do you know, I think technically that shouldn't happen if you look at vitamin C as a raw ingredient by itself. So when I hear that, I often do wonder about the formulation itself. So vitamin C, for example, works beautifully with vitamin E. So they have synergistic effects. So often the two antioxidants are used together. But vitamin E is an oil at room temperature. And vitamin E, for example, can certainly break a lot of acne-prone people out. So I think, from my point of view, I would wonder about the formulation rather than whether it's the raw vitamin C as such that's doing it. Because vitamin C is an anti-inflammatory. It would be unusual for it to do that.
One of my followers asked me and sent me some pictures, and it looked like it was oxidizing in her pores to make it look like she had blackheads. Am I imagining that?
I mean, it's tricky, isn't it? Because blackheads themselves would also be oxidized, which is why they're black. So it's really difficult to say. And then I have mixed feelings about vitamin C because I feel like it's such a hard ingredient to formulate and stabilize. I have no doubt that when the manufacturers make it and they bottle it, there is a degree of vitamin C in there. But every time we open up that bottle and we are putting a few drops onto the back of our hand to put it onto our face, oxygen is getting into that bottle. You do wonder if in a week's time of opening it every day, once a day or twice a day, or a month's time, how much Vit C is really left and how much of it has genuinely oxidized in that bottle. And it's just something that, you know, I do wonder. I do wonder.
No, I agree as well. What antioxidant do you prefer if you want a daily antioxidant?
Vit C is still my one of choice that I would recommend if somebody wanted to use one. And the reason I do tend to go for Vit C is because I think of all the data that we've got on antioxidants, and it feels like there's a new antioxidant serum coming out every week at the moment with a brand new fancy sounding antioxidant name. But I think Vit C's got the most data on it. So I like to stick with the one that I can see that there's enough papers on it. So Vit C is still my one of choice, despite what I've just said.
Yeah, no, I mean, I agree. I think for me, the new generation water-soluble, stable vitamin Cs are interesting. They're less powerful, but in some ways they're much more pleasant to use.
Yeah.
And I suppose it depends how much time you spend in heavily polluted environments, really. I mean, now we're all at home at the moment. Talking of which, SPF. SPF every day, even when you're inside on a day like today. This really set my Facebook group on fire, this question, I can't tell you.
I think that's so interesting. And I'm surprised it's so controversial as well in some ways. But I'm just going to say that if you're indoors, you're not getting very much sunlight. So unless, of course, you're sitting by a window all day. And the reason I say about the window is because UVA is one of the wavelengths of sunlight. UVA will penetrate window glass. There is UVA around in the winter months. Then there is possibly benefit in wearing sunscreen at home. But if you don't sit by a computer by a window all day and you're indoors all day, and then you're wearing a mask when you do go out and it's pretty dark by like 3:30, 4 o'clock, you don't need to be worrying about it. But what I would say though is for a lot of people, sunscreen is part of their habit, isn't it? It's part of their routine. And I think if you're in the routine of wearing it, if you stop wearing it, it messes up with your routine. Just wear it anyway.
You literally just described my typical day there, by the way. I don't leave the house until it gets dark, and then I've got a mask on anyway. So have you got favourite sunscreens that you particularly like for different skin types? Because again, I did a series of 3 videos over the summer about the best SPFs, and I do think SPFs are getting better every single year. But do you have a favourite medical mineral sunscreen? Do you have a favourite normal sunscreen? And which one do you recommend for somebody prone to breakouts? Because that's the most common side effect.
Yeah, so I'm still a big fan of the HelioCare 360 gel oil-free one. I really do like that for acne-prone skin or skin that finds it becomes a bit shiny when they put sunscreen on. It's the only one that, for me, personally, I found doesn't break me out. In terms of mineral sunscreens, I really like the Jan Marini Physical Protectant, and I like the Neostrata Physical Fusion. They're usually my go-tos in terms of if I'm going to recommend a mineral one to somebody. I do also like the cooler one as well, the cooler mineral. I think that's quite a nice, easy, fun one to use. So, and then for sport, I like the Sunsense Sport. So couple there, and yeah, it depends really, but I think they're all very good sunscreens.
It's very interesting. The Cooler do great lazy body sprays if you've got like teenagers or children that are running around, don't want to wear an SPF, and they can come really high as well. I think they come up to like an SPF 50, which obviously you would need because spray SPFs are going to go on so much thinner. But
that's right.
Yeah, I mean, I think if you haven't either tried a recent formulation SPF, if you haven't tried a spray on SPF, if you haven't tried on an aerosol SPF or a gel tinted SPF, go and look at them when counters open up again. They really have got so much better than they used to.
Yeah.
This is an interesting one, and I don't even know if you've got somebody in your clinic that does this, but if somebody wants to have a facial, what facials do you recommend?
The thing is, facial is such a vague and a generic term. So it's kind of nailing down, what do we mean by that? Are we talking about a facial for relaxation? So you go, somebody does a little bit of massage to the face and they put some nice smelling things onto the skin and you have a really lovely, nice experience, like a bit like going for a back massage or a shoulder massage. So that is a type of facial. Or are we talking about a facial where we're talking, you go and you have an extraction and somebody squeezes out your blackheads. Then they stick a chemical peel on you and then they bathe you underneath some blue light, which is clearly very much more a medical type facial. So I think it depends on what it is you're trying to achieve and what your end results are, because neither of those are wrong. You know, I'm a big proponent, I support people and their mental health. Like anything that makes you feel good, you should do it. So if number one makes you feel good and then you're less stressed, it means that your acne and your rosacea and your psoriasis are much less likely to flare up. So that's definitely something you could do. In terms of the clinics that I work at though, we don't offer facials of the number one type, but you certainly would be able to get facials of the number two type, where if you wanted to have a peel and a bit of laser and a bit of light or whatever else it might be, that would be an option. So I think it depends on what you're looking for.
Do you need to see a dermatologist to access your nurses, your facialists, or not?
No, not at all. So there are estheticians that will do those treatments at the clinic.
Estheticians, that's the word I was looking for. Thank you. Do you have any favourite retinols that you particularly like?
Do you know, if I'm going to put somebody on a starter retinol for sensitive skin at 0.3%, I always go for Redermic R. If I want to put somebody on something a bit stronger and I think they'll tolerate a retinaldehyde, then I would probably go for the Medik8 Crystal Retinal 3 or 6. And then if I think that actually their skin is actually pretty resilient and I've seen them, I've seen what their skin is like, and I think they'll tolerate prescription strength, I'll put them straight on prescription strength. So I tend to pick one of those three, depending on what their underlying skin problems are. But I will slowly build up depending on what's going on.
So I have a question for you, and this might be out of our remit because I don't think they exist in the UK. Can anybody produce a retinaldehyde outside of Medik8 in the UK? I have a sneaky suspicion they're available on the high street in America, but I don't think we've got any here. Or am I?
We don't have many. I think that there are a few that might be coming, though. I think there's been a lot of interest in retinol or retinaldehyde in general. And I suspect over the next 12 months, we're going to see some more. That's what I suspect.
It was only because one of my American followers said to me, and I genuinely cannot remember the brand she mentioned. And please don't take this as being the brand she mentioned, but it was somebody like Neutrogena. It was somebody who's like a really mass market skin brand who's known for their good quality skincare, who had access to retinaldehyde. And for those of you who are watching who don't know, vitamin A has a metabolic pathway in the skin. Until a couple of years ago, the strongest we had before prescription was retinol. Now we have retinaldehyde, which is the next metabolic pathway short of retinoid. So just in case anybody knows, I'm not telling Dr. Mahto that, don't worry. I'm not teaching how to suck eggs. And I know nothing about this, so please, I'm just helping Martina XXXX. What do you think of the supplement Acumax?
Okay, so I'm
to be completely honest, which is what we love about you.
Okay, so look, I'm going to say skin supplements in general, and Acumax included, they always contain the same things. They always contain vitamin A, a little bit of omega-3, a bit of selenium, a bit of zinc, possibly coenzyme Q10. The reason for that is individually, all of those things are really important nutrients and building blocks for the integrity of our skin and our hair. This goes back to what I said about biotin though. That's great if you're lacking those things. But if you're not lacking those things, taking more isn't necessarily going to fix your skin. So I'm skeptical. I know that they've got really quite impressive marketing and advertising across social media. And I come across it myself. And then you fall down a hole, don't you? You look at one and then the algorithm will show you even more skin supplements.
Millions, yeah.
Exactly. But I think that there are better ways of looking after your skin, sunscreen, retinoid, than going straight for a skin supplement. And I kind of feel the same about collagen supplements as well. I think the data is pretty sketchy. I'm willing to be proved wrong if you can show me data otherwise, but I have yet to see data that convinces me otherwise.
What worries me about the collagen supplements as well, and again, I think they might work for vegans, but ironically, vegans can't take them because they're not vegan collagen supplements.
That's right.
Is this, why are they so bloody expensive?
Oh, they are. They are hideously expensive.
It's shocking. You can almost see the manufacturers thinking, let's make hay while the sun shines. It's shocking. I'm wary of the fact that I'm taking up your time, and your handsome husband is probably cooking you a gorgeous meal somewhere and waiting for you to join.
He is cooking dinner. I can hear him banging pots downstairs.
I know. He could adopt me any day. How to solve continuously dry lips, and a lot of people have mentioned this because of maskne and the dehydrating effect of the fabric on their lips.
Yeah, and there's unfortunately no easy answer. I mean, going for things that are occlusive, so prevent water loss from the surface of the lips, is your best bet. I mean, it sounds daft, but nipple balm. So, for example, my patients
Dr. Lip.
Yeah, exactly. It's fantastic. You know, they all get cracked lips. I tell them all to use nipple balm because it's a good barrier. And I do like the Dr. Lip. In fact, that is what I have been using all of this winter.
They've just sent me their new product downstairs, so I'm about to test it out. It's lanolin based. And I think what's interesting about lanolin is previously it's had a really bad rap. But actually, as a skin emollient, it's incredible. I mean, it waterproofs a sheep. It can waterproof your lip. Trust me, it really can. Yeah. The other one I like, if they don't like an occlusive, is, and please disagree with me if you want, I do love La Roche-Posay's Cicaplast lips.
Oh, yeah. Do you know?
It's lighter, though. It's almost like a serum you would put under an occlusive.
That's right. And the other one I like is the Eucerin Aquaphor lips as well. It's a similar kind of consistency, but that's also another good one.
Yes.
And then if my lips aren't that dry, I do like the Nux Rive de Mille as well. That's really nice.
That's slightly more sort of upmarket and cosmetic, isn't it? Yeah.
Yeah.
Now, before I let you go, you obviously did a peel in the first lockdown. I'm going to get you back on here because there's so many more questions. What DIY skin treatments are you doing in this lockdown? What can we look forward to on your Instagram?
Oh, do you know, actually, I have been thinking about doing the peel again. I've got it at home. It's been sitting in my drawer. The problem is that I've committed to like so much video and live stuff that I can't be peeling. So
the thing is, welcome to my Tret world. The only reason I can't do Trek is because there will never be more than 24 hours when I'm not in front of a camera, and I don't want my face falling off.
No, exactly. You can't be like, exactly. And that peel, I mean, it really makes your face fall off.
Okay, so how long, if everybody's reading this though and watching this and they want to go back, was it sort of April, May time last year?
It was around April.
Okay.
I don't think I did a grid post about it though. Well, I could share some photos though. I think I did some Insta stories about it, but I've got the photographs because I mean, you know, they were useful to show patients as well of what you should expect.
Well, if you don't mind, what you could do is you could do a sort of swipe left, you know, gird your loins if you want to see the pictures. Because for me, I mean, obviously, I love your content. So your content is always fed to me first. But I just remember being absolutely, it's not often I look at somebody's stories and think, I'm so jealous. Yeah. Why don't I live with a dermatologist? Because it was the best time to do all those treatments because nobody saw you. I mean, you share your journey, but for everybody else, it was so good. Was it the Cosmolan peel?
It was Demamelan. So Demamelan's a bit stronger than the Cosmolan. Yeah. But the other thing is I am thinking about purchasing a clinic microneedling device to have at home because obviously I can. Perks of the job. So yeah, that's the other thing on my list at the moment.
So I'm going to end this as I started this by saying you need to watch, follow, like and subscribe to everything this woman does. She's amazing. I'll get you back and should we do part 2 of all the questions we didn't get round to?
Let's do it. I look forward to it.
All right. Thank you everybody for watching. I will come on and help answer questions, but genuinely, although Dr. Mahto can't give medical advice because she's a clinical dermatologist and it would break her rules to do it, but her feed and her posts and the depth in which she goes on each subject on her main Instagram grid are incredible. They really are. And also she's got a great book. You haven't got your book with you, have you? I asked you this last time and you're supposed to hold it up at this point like QVC. It's called the Skincare Bible. You can order it and get it sent through, yeah?
Oh, amazing. Well, look, it's so good to see you. Have a lovely evening. And thanks, guys, for watching. Take care.
Should we come back on in a couple of weeks?
Let's do it.
I love the way I just asked you that. I've strong-armed you that. I didn't ask her privately before.
I look forward. This has been great. I really enjoyed it. So a few weeks' time.
Yes, definitely. I'm all yours. Thank you. Bye, everybody. Bye.